Hello, everybody, and welcome to this conversation with Noora Health. On March 6th, this past Saturday, Dining for Women changed its name, and now we are Together Women Rise. For those of you who may have missed the big reveal and the big announcement, we have videos of the announcement and of the event on our website and our YouTube channel. But for now, let's get started. Welcome, Edith. Edith Elliott is the co founder and the co CEO of Noora Health, and she is joining me from Minnesota, Michigan.
Michigan.
Michigan, okay. So hopefully your weather is as wonderful as I have here in South Carolina. A
You've got
beautiful
me
spring day.
a sunny day, still chilly, but it's a
A
sunny day.
sunny day.
A
Okay.
welcome sunny day. First in
Okay.
many, many months.
Let's go with it. And I believe you have a presentation to share with us.
I do. And thank you so much for having us and for this opportunity. It's just such a joy and a privilege. We're very humbled to get to have this conversation with you. So let me get the screen shared and get the presentation going. So hi, everyone. I am Edith Elliott. I am co-founder and co-CEO of Noora Health, and we believe in the power of family to heal. So at Noora, we work in India in hospitals where we train family members to be care providers for their loved ones. And what got us there? We recognize that there are multiple challenges that the Indian healthcare system faces, and really that our global health system faces. And in India in particular, that is that healthcare facilities are overstretched, and families often leave facilities without the information that they need on what they can do to prevent complications or additional suffering that their family members, the patients, might be experiencing. And on top of that, there's this massive shortage of healthcare staff and healthcare professionals. In India, it's estimated that 2.5 million healthcare staff are needed to serve the population of 1.3 billion people. And on top of that, you only get on average 2.5 minutes with a professional, a healthcare professional in a public hospital, in a government hospital. So you have not enough healthcare professionals, patients spending the majority of their hospitalization alone, and family members who travel to the hospital, live there, but are not given the information that they need to keep their loved ones safe. So at Noora, our mission is to improve health outcomes and save lives by empowering family caregivers with the skills that they need to care for their loved ones. And our vision is of a world where patients and their families are a core component of high quality healthcare delivery. So how does our model work? Well, first we create engaging content. So I'm sitting in Michigan, but 98% of the team is in India and Bangladesh, where our work is. So we take incredibly complex medical information and we put it through our design process. So on the other side, you have information and tools and training materials that are in local language and that are very that are culturally relevant and specific to the patients and caregivers that they are developed and designed for. Then we use a training of trainers. So our program is delivered in hospitals and we train and upskill existing hospital professionals. So we're not going in as Noora Health and bringing a trainer into the hospital. We're using existing hospital resources. And then we provide implementation support. So sessions run, I'll show you photos in a few minutes of sessions. They run in hallways or in waiting rooms or in the ward itself. And we provide support to the hospital on the front end so that it can be a seamless part of the way the hospital is delivering care. And then we follow up digitally with patients and families. So we have a WhatsApp program and a text program where we can continue to send training and information and educational tools to families, but also can respond to questions. And of course, monitoring quality and monitoring output is of utmost importance. These are the various stakeholders that we serve: patients, of course, families, frontline healthcare workers, and public health systems. We are very much focused on serving the hospitals and the patients, families, and frontline healthcare workers who need us the most. So here are just a few photos of what this looks like. This is a session that's happening in a maternal and newborn care ward in a hospital in a hallway. So you have grandmothers, mothers-in-law, you'll see fathers in many pictures, and of course, at times the mother participating in these sessions. Again, here's a trainer running a session in a hallway in a hospital in India. Here's one that's happening in a ward. So you can see the mothers are lying in bed, and then you have grandmothers, aunts, mothers-in-law, and fathers participating. Here's a mother, you can see she's actually breastfeeding as she's looking at one of the materials that we've developed, and a mother out in a hallway. This is just a bit more about the follow-up, the digital follow-up that we can do. So there's a missed call that people leave. This happens during one of the sessions. There's a missed call. People are then enrolled and onboarded into the program. They get messages at timed intervals, and they're of course able to ask a question. So let's say you're seeing that the baby's skin is yellowing. You can ask, hey, I remember you saying something in the session about jaundice. Is this in fact jaundice? And our team is able to support. This is a photo of someone interacting with that WhatsApp line. And I've included a few photos from the last year. Our program did continue running throughout COVID. Of course, it looked a little bit different functionally. There had to be a bit of social distancing, and you see everyone wearing masks. But the program did continue to run. Here's a father being onboarded to the WhatsApp line, a mother watching one of our videos. So just to give you an idea of the scale of our impact, we're in over 160 hospitals across India and Bangladesh. We're hyper focused on measuring the outcomes that we're able to achieve. And we've seen a 3x increase in skin to skin care that you might be familiar with kangaroo mother care, an 18% reduction in neonatal complications, and a 54% decrease in newborn readmissions. That means a baby was discharged from the hospital, then had to come back due to a serious complication. And we were able to bring that number down by 54%. Very briefly, this last year was a monumental one for us. We crossed over the 1 millionth person trained mark. And through our COVID response, we were able to reach over 15.6 million people with training and tools. We have over 5,000 nurses that we've trained to date, and our team is passed over the 160 number of people mark. And as mentioned, the majority are based in India and Bangladesh. We are so grateful to this community, and with your support, we are going to be able to scale our existing Care Companion program across India to achieve our goal of training 1.1 million new mothers and their families cumulatively by the end of 2021. And we'll do this by training 90 nurses across 3 states, Karnataka, Punjab, and Maharashtra, for those of you who are familiar with India. And those master's trainers will go on to train over 500 nurses and counselors in the healthcare facilities where they work. And then those nurses and those trainers go on to train families every day in hospitals across the country. So again, we are incredibly grateful to this community. We truly believe that in order to achieve that enormous vision that we have, it takes a family, and we're delighted to welcome you into our family. Thank you.
Thank you, Edith, and welcome to the Together Women Rise family. You're my first interview after we changed our name.
Exciting.
Anyways, you can stop sharing screen, and
Sure.
here's my first question for you. India is a really complex, culturally complex country, 22 official languages, thousands of other dialects, multiple medical systems, Ayurveda, ancient systems, and belief systems, and folk medicine, and all of that, right? So in that cultural context, how are you able to cut through and be taken seriously in the process?
That's an excellent question. So my co-founder and I met while at Stanford University. We were taking a course called Design for Extreme Affordability. And through that course, we learned something called design thinking, which is a way of solving problems that is very much focused on the individual and solving for the individual. So in our case, what that looks like, instead of going into a hospital and saying, okay, how can we, or into a community or health system and saying, here's an idea that we have and we're going to implement it and see how it works. Instead, it starts with deep empathy and listening. And what that meant for us was, I'm an outsider. I had no prior experience working in India, and having that beginner's mindset and listening, deep listening to what patients and families were experiencing and really needed. And yes, you're right. There are so many languages and so many practices, many of which are actually of extraordinary benefit to the patient, that are not part of the formal medical system. And what we did was first hear the extraordinary amount of confusion and anxiety and fear that patients and family members had, and then harken back to experiences we had ourselves as patients or family members. And a lot of that confusion was because nurses and doctors maybe weren't speaking the same language as the patient and their family. People travel hundreds of kilometers to hospitals when there's a major medical event in the family, and they live at the hospital. The entire family will live at the hospital, sleeping in the hallways, cooking food outside. It looks very different from the hospitals in the West. And outside of that very short discharge moment, when they're getting ready to leave the hospital, they're not engaged in the hospitalization in any way. And so providing people with the information upfront brings that anxiety, that worry, that stress down. And most importantly, doing it in their language and in a way that is culturally relevant and contextualized. So you're not giving someone, typically when you're discharged in these circumstances, you're handed a bag of pills and a piece of paper that you may or may not be able to read. And even if you can read it, it's in medical jargon. People immediately forget 80% of what they're told. And so what we do is repackage that in a way that is sticky and interesting, and yes, in the right language, but also culturally relevant. And people really appreciate it. And it seems to have an impact on the other side.
Mm-hmm. Absolutely. So at Together Women Rise, we are seeing more and more projects that are shaped by the digital world. And I think what makes this so interesting, I was somebody who grew up in Mumbai without a telephone in my home because, the system was so bureaucratic. You kept going down in the waiting list, etc. And now in the digital world, everybody owns a cell phone. At least every family has a cell phone.
Yes,
I believe India has the largest number of cell phones, 500 million or something like that.
It's
And to use that technology that is going into every little village to leapfrog into the modern world and use it for these things is so wonderful. Do you have a story to share with us?
Absolutely. It's remarkable. We do see that there's one smartphone in every family. When I first started working on Noora Health only, 6-7 years ago, that wasn't the case. And the speed at which that has happened is remarkable. And most importantly, even if there was a smartphone in the family at that time, they didn't have data, right? So it was a brick. You could play games, and until you found a Wi-Fi hotspot, you weren't really able to use it. But now there are these extraordinarily inexpensive data plans. So suddenly, again, almost overnight, everybody had data on their phone. And we saw that coming and tried to be ahead of that curve, and are now able to reach people in their homes. Just the other day, we received a video from a gentleman who was part of our COVID training. So we now, as part of our COVID response, we receive phone numbers from the government of COVID positive patients, and then we're able to do a teletraining with their caregivers to keep the other members of the family safe, and also help that caregiver understand when and if they need to take the COVID positive patient to the hospital. Of course, trying to keep people home as long as possible because hospitals were so overrun and in many cases continue to be and overstretched. So this gentleman had gone through our COVID training and had sent us a video because he was so grateful for, and it was all, the majority of that training is digital. There is a human component on the front end. And of course, we're there to answer questions, but he felt so supported and so grateful for these videos that he was able to forward to friends and family, people we didn't know were COVID positive and needed this, but that he knew needed it. And so that, to me, that sort of domino impact that you can't have with an in-person intervention is tremendous. It's huge. But I will say, even with the digital offering, we hear and see every day that the in-person piece is so fundamental. That compassion, that support that one feels when they're given the opportunity to ask questions in a group, they're given the opportunity to be in person with a nurse, with a trusted individual, or to get a phone call from someone, you can't beat it. So I think the two have to be married. You can't, I think having one or the other individually can become difficult, and we try to strike that balance of high touch and high tech.
Mm-hmm. So since the digital world is here to stay until the next revolution, I suppose, and in the little time that we have left, where do you see yourselves going next? You have partnerships with governments, you have expansion into different states. Are you going to stick with hospitals and health systems, or are you going to branch out into something else?
No, we will stick with hospitals and health systems. We do have plans. Our expansion plans are exciting. We're adding additional states, as well as, more recently, we've we've started our work in Bangladesh and plan over the next 5 years to go into at least one additional country. We believe that this is not just an India problem to solve or a South Asia problem to solve. There are hospitals down the street from you and I who could benefit from a program like this, but we're also not naive to the fact that Noora Health cannot be in every hospital everywhere in the world. So a big part of our job, we've been very focused on, boots on the ground, showing that this model can work, and measuring the clinical outcomes of that. Now, part of our job is going to be to create a toolkit that others can use and replicate, and ask ourselves, is there a way for us to make this the standard of care in hospitals around the world? Maybe even put ourselves out of business.
Absolutely. What a wonderful idea. And especially for all of us who are now so used to telehealth, right?
Yes, exactly.
We're used to telehealth. We're staring into these little windows and
Exactly.
we're just getting used to the whole thing and videos and all of that.
Yeah.
So thank you, Edith. Thank you so much for
Absolutely.
being with us. This was absolutely wonderful. We wish you the very best.
Thank
And
you.
we look forward to hearing from you about the project as you submit your reports. So
Thank
thank
you
you.
so much. Thank you.